Hello, everybody. Thank you so much for joining us this evening. It's great to be here this evening, and I welcome back my colleague, Dr. Laura Haynes. Hello, Laura. How's it been for you this week?
Today we're in Canada. I'm so glad to have Dr. Gillies and Jojo Ruba with us as our guests.
Well, I'm really looking forward to this evening. These are people with an enormous amount of experience and are doing a great work in Canada in terms of pushing back with respect to legislation that really is something that is very challenging, I know, for many people there, as it is showing itself to be in this part of the world. But just before we go there, I'd very much like to begin again by taking us on this journey into the ancient world. So this evening, we begin with the very first part of our introduction to Pompeii. Why are we doing this? Well, I hope to be able to illustrate that the science of archaeology is very much concerned about evidence, and how we use evidence really depends on the ideologies we discover. And I think there's a parallel in terms of the exploration that many archaeologists are undertaking in this area in relation to whether or not there were Christians and Jewish people in the area before the eruption in AD 79. Take a look at the first part of this documentary. A magnificent view, looking out over the Bay of Naples and not far from the Campanian archipelago. This has to be my most favorite place in all the world. We're in the bustling seaside town and holiday resort of Sorrento in South Italy. We're about to go on a journey to some ancient sites, to the ancient city of Pompeii and to Herculaneum, but we'll also visit an imperial villa in Oplontis. I think it's really important to ground what we're about to do in European Western culture. So where better to begin than in the ancient cities, to see the difference between how the rich and the poor lived, to see how they lived side by side, how they were influenced by each other. I'm fascinated in the difference between what historians have created as the presence of people as opposed to the silence that is sometimes represented in the cultures that we see. So what we're going to be looking at is the material remains of presence and absence or silence. And I'm very interested to hear the voices of the silent. I think that this has a modern construction in the sense that today people are being silenced. People are not allowed to express their points of view. People are not allowed to live the lives that they want to live according to the truth that they see it. I sometimes feel that we are having something imposed on us, an ideology that we have to accept. And if we don't accept it, we're going to be ostracized and punished. So I see a certain link between what is happening in modern day Western civilization and what happened with the slaves in these three cities or these three areas. The fact that the slaves had no voice, no opinion, that they had no rights, no freedom, they were property. And we're going to be seeking to understand a little bit more about the plight of the silenced. So come with us as we journey back in time and try to see what the ancients have to teach the moderns. I'm taking the short 10-minute walk along one of Sorrento's main roads, Corso Italia, to Sorrento Station. My destination is to Pompeii Scavi, or the excavations. Be sure and buy a return ticket. It's just a few euros. I prefer the train, but taxi and bus are also options, and it's a quick 30 to 40-minute journey towards Naples City. Make sure you've got comfortable accommodation for when you get back, or wherever you're headed for, preferably with a pool. You're going to need it. The best thing is to do your reading before you get there and decide what it is that you want to see. Just know you can't see it all in one day or even in a week. Well, to be truthful, I've been coming for years and have hardly scratched the surface. If you arrive at Pompei Scavi Station, you'll be heading into the site via the Porta Marina gate. At the Porta Marina, you'll enter through the ancient fortified walls. When Pompeii became a Roman colony in 80 BC, about when the amphitheatre in the city was built, the city walls no longer served their defensive purpose, and so in some places its walls were built over by the citizens, no doubt all wanting prime locations and sea views, but of course the sea is somewhat retracted since the eruption. If you want the Forum and the main public buildings, then Porta Marina is the place to start. If you want the amphitheatre and suburban Pompeii, head for the amphitheatre gate. Both are pay points. I'm looking for a bird's eye view because although this is a small city by modern standards, it's a huge site to try to get to know. I'm outside the buildings of Eumachia, daughter of Lucius Eumachus, who amassed a large fortune as a manufacturer of bricks, tiles, and amphorae. She was patron of the fullers or the launderers and used her social position and wealth to obtain the status of public priestess of the goddess Venus. She represents high-flying women and the only political office able to be held by a woman. I don't even think she could vote. It looks like here's my chance for the bird's eye view I was looking for, or at least a view of some of the city. You'll get a good view of some of the city here for sure, but it's also important to get your bearings with respect to how close Mount Vesuvius is from this vantage point. It's really only about 8 kilometers or 5 miles from the city. Bear in mind that Vesuvius would have been considerably higher before the eruption, and that a huge volume of its mass was deposited on the Vesuvian towns, pushing the coastline further back. This was no small eruption. There's a couple of practical things to be said about those wanting to locate places in the city. In the mid-19th century, Giuseppe Fiorelli is credited with dividing Pompeii into 9 regions. He referred to street blocks as insulae or islands. The singular is insula. And he numbered all the doorways within the insulae. That's really the standard map, if you like. And by the way, if you want to check out almost any uncovered or excavated area in Pompeii, you might use the Pompeian Pictures website. Just enter the name of the building or the region, the insular door number perhaps that you're interested in, and you'll most likely be rewarded with photographs and as much additional information as you can absorb. It's a great resource. I was here 5 years ago and I love coming back here. One of the things to remember about Pompeii is that it wasn't just a city of single-story buildings. Usually there were double stories and sometimes 3 stories high. But the effects of the flow from Vesuvius were such that it destroyed the upper levels first. And so that's why you see almost an ocean of 1-story buildings behind me. There's an enormous amount that this city and this civilization can teach us in the modern era. What was it like before the gospel of Christ? What I'm particularly interested in is the voice of those whose voices are difficult to hear in this place. We don't hear from them because we don't have their words. Maybe they were people who didn't write things down. They may have been illiterate in the true sense of the word. Maybe they were not the subject of sculpture or painting. And if they were, it would be in the role as a servant or as a slave that they would be featured. But they are individuals who had lives and personalities and beliefs and religious systems. So over the next few months, I'm hoping to introduce you to some of my friends in different countries and to listen to people who have an expertise in this field who want to comment on the things that we do. I'm hoping that you'll join us over the next few months. I think it's important to ground all of this work in the very fabric of European Western civilization and culture. Where better to do that than in Pompeii, an ordinary town in the great Roman Empire where ordinary people lived and worked and went about their business, and where the issues of sexuality were as important for them as they are for us today. I think what's going to be apparent is the incredible age of much of this site. The thing is that Pompeii, as the other Vesuvian towns are showing, were not originally Roman towns. The Roman cities obviously built on earlier foundations as far back as the 6th or 7th century BC. The name Pompeii, by the way, seems to be derived from Pompey, meaning 5, and many believe that this captures the fact that the town came from 5 streams of people. Strabo, the Greek philosopher and historian, tells us that both Pompeii and Herculaneum, mythically connected to Hercules, were built by the Oscans, early Italian people, to be influenced later by the Etruscans, Samnites, and Romans. I guess one of the ways to begin to understand the city's ancient past is to take a little time to think about all the temples and deities evident in the city. Talk about a mixed bag. There are no less than 8 temples dotted around the Forum, in between the most important public buildings. And the Forum is the oldest part of the town. I'm going to make my way to one of the earliest temples, what's known as the Doric Temple. So the next time we come together, hopefully we'll see the Doric Temple, which is a very ancient place in the city of Pompeii. It was in fact defunct as a temple at that time. It was built by during the Greek dominance in the area. Stay with us and let's listen to what is, I think, a fascinating account of voices that have been forgotten and lost, including Jesus devotees and people who apparently served the living Christ, even in the 1st century, possibly in that city. Now, it's time to welcome our guests, and I'm going to ask Laura to help us to introduce Dr. Anne Gillies and Jojo Ruba. So let's start with Jose. Could you introduce us, please, Laura?
Sure, Mike. I'm so happy to introduce Jojo Ruba. Jojo Ruba is the communications director of Free to Care. And that's an organization that supports freedom of Canadians to have support and care they choose for sexuality and gender issues. He organized the largest response to a city bylaw in Alberta, the conversion therapy ban, which was the conversion therapy ban in Calgary. And at the hearing, he gave his personal testimony of benefiting from change allowing therapy. Now, Jose is also the executive director of Faith Beyond Belief. That's an organization based in Calgary, Alberta, Canada. He speaks to Christians at venues such as churches and Christian schools on how to explain their worldview to non-Christians in everyday, ordinary language and ordinary conversations in ways that help non-Christians understand. He also helps Christians ask non-Christians the right questions. Among many things Jose has done is that I find most interesting are that he has spoken at debates in secular universities. And currently he's helping to organize a national campaign in Canada to support the right to therapy choice. His educational background is that he earned a Bachelor's of Journalism and Master's in Political Science from Carleton University in Ottawa. Jose, I'm looking forward to hearing your insights and strategies for supporting the right to therapy choice. And I'm wondering if you could give us now the 2-minute version of your personal testimony.
Wow, 2 minutes. All right. I'm already taking up 2 of those minutes, right? I'm back in Ottawa, which just happens to be our nation's capital in Canada, and where I got my journalism and political science degree. And the reason why that's important is when I was a university student, I actually told the staff worker at InterVarsity, a Christian group that I was part of, one of the few people that I told at that time that I was same-sex attracted and was struggling and needed help. and she gave me a phone number of a Christian counselor that I could go see. And today, that action, if Bill C-6, which is the bill we're fighting federally, were in place, that action would be considered promoting conversion therapy and would be criminal. She could go to jail for up to 2 years just for giving that information to me. That's where we're at right now in Canada. We're in a very, very scary place in the sense that the bylaws and the law, the federal bill that's being debated right now, is unlike anything in the world. It actually bans counseling, not just for orientation change, Dr. Laura, but it actually bans counseling just for behavioral reduction or repression. So even though my sexual attractions, I still have some of those, if I get counseling just to help reduce or manage that so I don't act, or I'm encouraged to stay and not act on it, that itself would be criminal. The counseling that someone could offer, a therapist, or even a pastor preaching at a church, declaring that there's a prayer meeting where this will happen, where people will pray for me to reduce my attractions or behavior, would be considered conversion therapy in Canada.
Thank you, Jose. And
I'm really intrigued by this training and background that you've had as a political science student, but also in journalism. It sounds to me that that's a winning combination in terms of the work.
Well, that's part of the struggle, Michael. It's we're in an age where we don't need to look for information. Information is really easy to find most of the time. The problem is how to navigate through strategy is. We need to be able to communicate it to a culture that is hostile to us, that doesn't understand us, that thinks that we're unnecessary. And that's people in our church I'm talking about, let alone the hostile culture around the church that actually don't like Christians at all, especially in the West. I think the US is just a few decades behind us, maybe a decade. But Canada is somewhere in between Europe and the US in terms of the hostility to the church, to Christians in general, and to any kind of biblical teaching on sexuality.
Well, I just know that people are going to appreciate very much what you have to offer tonight, Jose. So thank you for being here. I get the easy job in introducing Dr. Anne Gillies because she's produced an introductory video that I think is really worth taking a look at. So let's have a look at that.
Hello, I'm Dr. Anne Gillies, a retired psychotherapist. The following conversations are between consenting adults. These individuals have asked me for help. These conversations likely violate Calgary's bylaw against conversion therapy because I seek to help these individuals reduce their unwanted non-heterosexual attractions or behavior. The law makes no distinction between consenting clients and coerced clients. According to the bylaw, the penalty for having such a conversation is $10,000 or jail time. That's right, I could go to jail for talking to someone who wants to talk to me. The federal bill, called C-6, would make this conversation a criminal act if the counselor offering this service is a paid professional. Showing support for others doesn't mean we always have to agree with everything they believe or everything they do, right? Shouldn't the law respect our right to disagree? Shouldn't LGBT Canadians also be able to get the support they choose? The law should respect our personal choices.
And there has to be a reason for your passion and concern. You've been a trauma specialist for many years now, working at the coalface, so to speak, in terms of people's hurts and injuries psychologically. But give us an understanding of why you're passionate and what's behind this drive in you to stand up at this time as you are doing.
Well, it's a long story, but I'll keep it really short. Basically, I started this this whole educational perspective many years ago because of what my kids had endured. And so they had been sexually abused by their biological father. And I didn't find out until after we'd actually divorced for some other issues. And so that was the beginning. And so I went back to school in my late 30s to actually get education to actually help my children. I wasn't looking for a career. I really wasn't looking to do what I'm doing now. I could never have imagined it, but it's my passion for what has happened to children in our culture in the Western world. I mean, it happens the world over. And so really it comes down to this issue of childhood trauma and how it affects the psyche and how it affects our behavior, our motivations and our behavior throughout our lives. And so I see it as a direct effect on our sexuality and how we then begin to express our sexual needs and desires. And so that's part of all of this, and that's really where it started.
Well, that is quite a story, and something that I'm sure could be dedicated to a whole program, each of you individually. So again, you're very welcome. And just before we bring you into a panel and we have a discussion about what is happening in terms of C-6 in Canada, I want to say how much I value the input of Dr. Laura Haynes. Now, I know that what she is about to present is critically important in terms of the issue that C-6 presents, but I think other country areas will learn a great deal from her. So I want to say that she's agreed that her PowerPoints will be made available. If anybody would like them, you can write to info@iftcc.org, and we'd be very happy to pass them on to you. They may be a bit small on the screen, but we'll send them to you if that's what you would like. So Laura, over to you.
Thank
What's
you, Mike.
on your heart and mind today about C-6?
Well, I've been following Canada's Bill C-6 for months now because I'm very concerned about it. It is a seriously harmful bill. This bill will forbid any counselor or pastor from helping anyone, even an adult, reduce any sexual behavior if it's sexual behavior between a person has with someone of the same sex. What could go wrong? This is a disaster. I mean, this is like waiting for the 100-car pileup on the freeway that you can see coming. So I think that I think it would help if we just take a look here at what the bill actually says. I have a slide that gives a quote from the slide. And what the bill says is it criminalizes a practice, treatment, or service designed to reduce non-heterosexual attraction or sexual behavior, with punishment up to 2 years imprisonment for helping an adult and 5 years imprisonment for helping a minor. Now, I think that all of us, really, people of goodwill across viewpoints, worldviews, political parties, I think all of us can agree there are sexual behaviors we feel everyone should have the right to have support to help them reduce, regardless of which sex it's directed towards, whether it's directed toward the same sex or the opposite sex. For example, everyone should be able to have help to reduce sexual behavior that's unlawful, non-consensual, unsafe. It might cause someone to accidentally be harmed. That's a psychiatric disorder. You know, there are some people who feel they compelled to reenact a sexual trauma they knew they had, and they should be able to, so that reenactment is sexual behavior, and it may be towards the same sex, and they should be able to reduce that behavior and have help to do it. Sometimes it may be costing them too much time and money that is being absorbed in some sexual behaviors. They want to reduce that. And it may be interfering with just having platonic relationships with friends or people at work, and they want to be able to do that. It may be interfering with their marriage and holding their family together. And I think most people feel people should have the right to support, to save their marriage to the person they love and keep their family together so they can go on being full-time moms and dads. And people should also have the support they want to live according to their religion, which is deeply in their heart and meaningful to them, and it's their core sense of their self. Okay, so people should read. Now let's go to the next slide. There is research that shows that men can successfully reduce unwanted casual same-sex behavior effectively. This research was published by gay-affirming researchers in peer-reviewed journals. They used gold standard research, replicated randomized controlled trials that showed that the men maintained drastically reduced their same-sex attraction, significantly so, and maintain the change at 6 months, 8 months, or a year follow-up evaluation. And these men were from a range of ethnic groups, levels of education, incomes, who were successful. They were reducing drug use and casual sexual behavior to reduce HIV transmission. Now, the studies found that men were especially successful if they were in a marriage, if they had children, or if they this behavior was not consistent with their values. So these may have been men who were married with children or wanted to live according to their faith. Next slide. So most people may not know, most same-sex attracted people are attracted to both sexes. This is according to the American APA Handbook of Sexuality and Psychology. It says, hence directly contrary to the conventional wisdom, individuals with non-exclusive patterns of attraction are indisputably the norm, and those with exclusive same-sex attractions are the exception. And next slide. Many of these are in an opposite sex relationship. In the UK, 31% of LGBT identified individuals are married, 2/3 of them to the opposite sex. And in the United States, 86% of bisexual men and 73% of bisexual women who were in a relationship were in an opposite sex relationship, most of them married. Next slide. And research shows that those who are of traditional faith are more likely to be in an opposite sex relationship, where 80% experience relationship satisfaction is real, and many of them have children. Their core sense of self is their religious self, not their sexual self, and they are no less happy, mentally healthy, satisfied with life, and flourishing. So last slide. A study that just came out this week showed that men were able to reduce not only their same-sex behavior, as these other research showed, but also their same-sex attraction. Over 2/3 reduced their attraction. 71% reduced their married men reduced their same-sex behavior down to only 14% of them still had same-sex behavior. Think what that means to these families. 61% reduced self-esteem. Nearly 3/4 said their depression decreased, and many said that this reduced suicidal thoughts for them. So I believe everyone should have the right to support that helps them change behavior that doesn't work and attractions that don't work for them, and help them live the way that gives them health and happiness.
Well done, Laura. I suspect you didn't have enough time there. Are there things that you still need to say? Because I think we should take the time to hear them. Are there other aspects that you just want to talk about relating to this?
I did my best to try to summarize everything in there quickly.
Sure.
Inez, there are some more things I could say about the research.
I tell you what, just for those, just before you do that, just for those of us who are struggling maybe to get a hold of this, just summarize again what the
Okay.
main points are that you
Okay.
are wanting to communicate with us tonight.
I think this bill has a very narrow view of what same-sex sexual behavior is. They think it's just a gay man with gay men in private relationships, and that you shouldn't help them reduce that. That's not how most people who are same-sex attracted are. Most of them are attracted to the opposite sex of those who are in a relationship. Most are in an opposite sex relationship because they want to be. They love their partner, and they want to reduce their temptations to stray, to protect their marriage and protect their family. And some want to live according to their religious faith. People may assume if someone wants to make their sexual behavior consistent with their religious faith, that, well, there's just somebody outside them that is trying to influence them, and they couldn't possibly decide, but just from their self-knowledge and their love of their religion and their wish to protect their marriage and family, that they want to reduce same-sex attraction and behavior. So the idea that people of faith could not freely choose these changes is itself offensive. Everyone should be able to reduce same-sex behavior or attraction who wants to, and for whatever reason they want, without discrimination as to the reason they want it. They, not the government, should decide about their sexuality and gender.
That's really helpful, Laura. I think let's bring Anne and Jose into a panel discussion now, because I think there are some questions that we need to be asking them. Can we do that? Thank you so much. Jose, I wanted to ask you, I know that something happened in Alberta. I know Anne was involved in that in the beginning. I'm not sure if you were.
I was.
If I understand correctly now, Bill C-6 is a federal bill, but something happened in Alberta. Can you just differentiate between the two and help us to understand what's going on here?
Well, to give you a context, there's a gentleman who's a professor who's a self-proclaimed expert on sexuality and gender because of all of the degrees and accolades he's been given, who was working for the provincial government, our state government in Alberta. But when the socialist government got defeated, he had to turn his energies to other political bodies. And so he wrote a document how municipal governments must pass conversion therapy bans. Because, and this is how they talk, every church is torturing a gay child in its basement. And he even alluded to in his testimony in one municipal government that a conference that I was speaking at, a huge Christian conference, nothing to do with conversion therapy, but they had one session on how Christians can talk about sexuality. And we had people sharing their testimonies of being Christians and same-sex attracted. That itself was promoting conversion therapy. And so he's shopped this document around in about half a dozen municipal governments across Alberta in the province of Quebec. And now he's lobbied the federal government to pass a bill which is almost the same word for word definition of conversion therapy that is unlike anything in the world. And that's how those two are connected. He's actually also lobbied the government to remove the charitable status of organizations that support conversion therapy. But because his definition of conversion therapy is that it's an attempt to practice treatment or service to change orientation or to reduce and repress non-heterosexual attractions and behavior, that means counseling for behavior reduction can be banned even if it's not about changing your orientation. And that means if we advocate for reducing behavior, which the Bible does, which every church that actually still believes the Bible does, that churches will lose our charitable status within the next 2 years if our current government is reelected. So this has huge, massive implications about how the church functions. And we're seeing now, frankly, so many churches capitulate to this and losing biblical small o orthodoxy about what we teach about sex.
Laura, I wanted to just ask you something here because, correct me if I'm wrong, but this sounds very similar to the Memorandum of Understanding on Conversion Therapy in the United Kingdom, because certainly there are echoes behind that document in institutions like the UKCP, the United Kingdom Council for Psychotherapy, which, when I was put out of my own professional body, was very much concerned about the reduction of behaviors. So any individual who was caught reducing or attempting to reduce same-sex attractions was liable in terms of this being an ethical offense. So am I correct? There are parallels here.
Yes, I think there are. In reading the MOU, to me, it's not clear and needs clarification. It says that you cannot help someone reduce or suppress same-sex behavior or gender expression if it is based on a viewpoint that one sexual attraction or gender identity is preferable to another. So does that mean that if someone doesn't hold that viewpoint, they can reduce any same-sex behavior or gender expression they want? But if they have don't have an approved viewpoint, they can't? I think that's discriminatory. Or is it that, or are they saying that no one can have help, this kind of help?
And it's very interesting, isn't it, that what they do say, it's qualified persons who can do some work in this area. But of course, we know that in this country, a certain political lobby is the judge, the jury, and the executioner. You can't get in to do the research and into training unless you hold a certain point of view. So this is a real lockdown, it seems to me. Anne, I wanted to ask you, and then let's open it up and continue our discussion. What about people who have been abused? What would Canadian legislators say to men and women who, you know, in the words of their own understanding of their stories, feel that their homosexual inclinations began following abuse? What would the professionals say, or what would the lobbyists say in Canada in terms of whether this could be addressed?
That's a really good question. And one of the things that we hear over and over and over again from lobbyists, from activists, is that we cannot say that any of these individuals are wounded. They actually, in my estimation, those who are seeking help are really being suppressed to even express the fact that they have been sexually abused, physically abused, or any of the major traumas have happened in their lives, because the mantra is that you can't talk about that because then you will look like you're wounded. And so that means that these people are not getting the help that they require. And I mean, that's discriminatory, because if you're heterosexual, of course you can go and talk about being raped as a child and how it affected you. And so many gay men have talked in the past about child abuse, just a large percentage, and how it affected their psyche, how they began to wonder, does this mean I'm gay? Does this mean that I'm going to be attracted like this all my life? And many of them have actually said that is exactly what started them down this trajectory. We aren't going to be able to talk about these things and help these people.
And Anne, can they talk about it? What happens if they share their own stories? What's the situation there?
To a therapist, if they can share their story, but if they suggest that one of their goals is to reduce same-sex attraction, because they feel it's interfering with the therapy that they're getting and their goals, that because often when we're doing therapy, as people begin to recognize the deep woundedness, they also begin to recognize a lot of things about their behavior sexually. For some, So for an instance, it may be someone who is a prostitute and she wants to reduce that, but if it's with lesbian sex, that's going to be an issue. So she wants to get help with the trauma that put her in this place in the first place, but then there's a place where we can't talk about certain things, because the mantra is not only that, are you not wounded? Don't talk to us like that. And we know that every single human being is wounded sexually in one way or another. And maybe wounded isn't the best word, but I mean, we have wounds. And the other part of it is that we cannot say that the individual can change, because the understanding in Bill C-6 is that the same-sex attraction, gender identity is immutable, which doesn't really make sense when young children are changing all the time. So the bill, the bylaw, is really restrictive, because we can't talk and we can't say to people, well, actually, a large percent of the population doesn't feel they're born that way, and they know that other things have contributed. So that's kind of a long answer, but basically, once we come to one place in therapy, and that is the same-sex attracted or the gender dysphoric wanting to desist, that's a no-go.
So have I got this right now? A man who, falls in love with another woman who is married, he's married and he falls in love with another woman. He can go to a therapist and say, I really need some help here. I've kind of stepped out of things and I'd like to do something about this. I'd like to alter my behaviors, and I don't want to go in this direction. He's okay. But
Yes.
the man who falls in love with another man and he goes for therapy, well, he can't be helped. He just has to suck it in and swallow it. And am I exaggerating here?
No, not at
That's
all.
how it is.
That's how it is. And I gave an example in my own testimony yesterday to the Regina Council about a young woman, married woman with children, who had become addicted to pornography, lesbian pornography, from her childhood. And so I gave that example. And one of the other presenters said, well, pornography isn't a behavior. And I'm like, all of a sudden, I'm kind of going, what are you talking about? This is how incredulous the thought process is for the individuals. But I would not be able to help that woman, even though she's on the verge of having a lesbian affair and doesn't want to do that. She wants to save her marriage for many, many reasons, that I would not be able to help that woman. Of course, the other side is saying, oh, no, she really isn't. It's not a behavior, so you're okay. Well, that just doesn't make any sense at all, does it?
Thanks for clarifying that. Laura, I'm going to ask you to ask some of the questions in a minute. I'm going to ask my last one, then it's over to you, because I'm sure you'll have some questions. Jose, I want to just touch on what you said earlier. You spoke about the fact that it seems as though many churches are kind of capitulating on this and are becoming, so-called inclusive. Why is this? What's happening here? What's gone wrong? There seems to be, something major happening here. Can you speak into that a bit for us, please?
Well, there's two things, and this is also part of a communications thinking as well. So the term we use are revisionists, people who want to revise the Bible to teach it whatever they choose. And the term I like to use to describe our view is redemptive, because we believe every aspect of our reality, including our sexuality, should be redeemed. And it's a sort of promo for the book I'm writing as well about sexuality. So in terms of that, this is the challenge that's in place. The first one is that the church itself doesn't know its Bible. So Christians don't know the facts about what we believe. What your group and what your organization is doing is excellent. We need people like you to keep speaking out. We need Dr. Laura to keep speaking out, presenting the facts. It's critical, and we would not be where we are at today in Canada if we didn't have the truth on our side. But the other part of that, the second part of that, is not only do we need to present the gospel as true and our position as true, we also need to present it as good. And right now, the people who speak against us assume we're the bad guys. And many in the church are starting to internalize that idea that we are the bad guys and we have to apologize for everything we believe. So, as I said, I'm in Ottawa right now. I met some old friends from way back, Christian family. And I know the parents. I got to know the kids as babies, and now they're teenagers going to high school. And as soon as we started having a conversation, this issue came up, and instantly they said anyone who doesn't use the transgender person's proper pronoun or desired pronoun, you're completely an irrational discussion. Where one of the young men actually had to agree that anyone who claims anything, including being transracial, has to be respected, because anyone who would dare disagree is not a morally good person. So in terms of our communications, especially in the church, we need to remind people again that every aspect of the gospel, every law that God gives us is good for us. And if we don't do that, it doesn't matter if we present the facts, they will not listen to us.
That's very helpful. You know what really excites me about what you're saying, Jose, is in the ancient world, in Pompeii, in the Roman Empire, well, it was Christians who were considered to be atheists, in a sense. They were outside of the Roman cult. And peace reigned in the world because everybody was worshipping the emperor and worshipping this great pantheon. And then the gospel came, and the Christians said, well, we're not going in that direction. We'll do what we can, but we serve the living and the true God. It seems to me we're almost back there where conditions are ripe now for the kind of persecution that came against the church on many occasions.
I would just add one quick thing, though. The difference is the people persecuting us think they know what Christianity is because we're post-Christian as opposed to pre-Christian. And so there's going to be a lot more difficult challenges, especially with self-proclaimed Christians from very revisionist denominations, let's just use that term, who, especially when we're speaking publicly, say, no, these people don't represent Jesus. Our Jesus is all about love, and these people have no idea who Jesus is. Not realizing that that's a completely different Jesus, because it's a different definition of love.
Good point. Well done. Laura, have you any questions? We're going to have to wind this up in a few minutes, but go for it.
Yes. Okay. So I want to ask Anne about adolescence, because it's being said, well, adolescents couldn't possibly freely choose to have therapy to reduce same-sex behavior or attraction, or an adolescent couldn't possibly choose to have therapy to who went over to identifying as transgender and who wants to go back to embracing their body sex. They couldn't possibly freely choose therapy. But first, I want to quickly make one comment about something you've already said, which is that the American Psychological Association's APA Handbook of Sexuality and Psychology says childhood sexual abuse has potentially causal links to having same-sex partners, and they base that on research that includes a 30-year study of documented cases of childhood sexual abuse. So your clients who feel that there is that connection are not alone. But I want to ask you about adolescence.
Well, so you're asking if they're saying that yes, adolescents can really, they can't consent to therapy, and yet we are suggesting that adolescents can consent to changing their bodies according with their thoughts. So there's so many things and so many layers to this. So adolescence, and you know this, Dr. Laura, that really our brain is not completely developed until we're 25 years old. So there's a lot of incapacities. No, maybe they're not incapacities, but it's the development that's happening. But there's a need. That's why we have parents. parents are the ones who need to be making wise decisions on behalf of their children, and especially their children's sexuality. And that is what has eroded, because what now is happening is that children have the right to sexual expression, sexual behavior, and that there's no age limit on those rights. And so what we have is children making decisions that are going to affect them for their entire lives, and yet we're disallowing those very children to get counseling if they should choose to reduce or to eliminate even their behavior in one way or
And
another.
have you had any experience with an adolescent who you felt freely chose therapy to reduce their same-sex behavior, or who freely wanted to return their gender identity to identify with their body sex? I think you've done some counseling with people like that.
Well, I would say that the adolescents, and I would always tell parents, because the adolescents weren't the ones that called. Mom and dad are forking the bill, for one thing, but the adolescents could have been in agreement with mom and dad and say, yeah, I really want to get some help. I'm kind of concerned. Or the adolescent could be saying, you know what, I really don't want to go for counseling. Can we do this another way? But mom and dad have already decided, come on, let's go for counseling. Let's see what we can do. So is that forced? I don't think so. I think parents need to have that right, and children need to be able to ask for those kind of things.
Jose and Dr. Laura, I'm just going to bring us to a close now by pointing out what has been happening here in Northern Ireland. Some of you may not know that Laura is in California. I'm in Belfast in Northern Ireland, and our guests this evening are from Canada. Now, on Tuesday, the 20th of April, this month, just last week, our Legislative Assembly undertook a symbolic event. It was non-legislative, non-binding, but it was a symbolic vote to test the view of the House, if you like, about conversion therapy. Take a look at this clip and just listen to what was said by the motivator. I'd love to get your opinion before we leave this evening. This is the final clip.
I'm a straight man. I was born straight. There is no fix or cure for me. There is no therapy that will make me a gay man. So why on earth would we say that a gay man wasn't born that way? Why would we say that a gay man can be fixed or cured? Why can we say that there's a therapy to change a gay man into a straight man? There isn't. It's ludicrous. And if you believe that gay, lesbian, bisexual, trans, gender diverse is a lifestyle choice, there is nothing I can say here today to you that will change your mind. If that's what you believe, then that's what you believe. Conversion therapy is humiliating. It is harmful, and listening to those testimonies of individuals who have undergone conversion therapy, it is clear that it has far-reaching negative mental impacts. The continual promotion that somebody is broken or wrong leads them to feel they are worthless, and extremes lead to suicide. The British Psychological Society for Northern Ireland chairperson said, "Conversion therapies are unethical and unsupported by psychological evidence. Our society is committed to ending this practice. Sexual orientation and gender identities are not mental health disorders. However, those subjected to exclusion, stigma, prejudice may well experience mental health issues as a result." She went on to say, it is important that the public are made aware of the risk and the harms of conversion therapies. The UN independent expert on protection against violence and discrimination based on sexual orientation and gender identity said, actions to subject lesbian, gay, bisexual, trans or gender diverse persons to practice of conversion therapy are by their very nature degrading, inhuman and cruel, and create a significant risk of torture. A significant risk of torture. Inhumane. Cruel. I've got to say, those are words that should shake us all to the core when we think that some of our people here in Northern Ireland, our brothers and our sisters, our sons and our daughters, our teachers, our policemen, our nurses, our doctors, are subjected or could be subjected to that. It should shake us all. Yet it is happening. And it is happening here in Northern Ireland. Because we actually have a charity with charitable status and everything that goes with that charitable status, conducting conversion therapies here in Northern Ireland. They are part funded by the International Federation for Therapy and Counselling Choice. And do you know what they say? They say, witnessing domestic violence or suffering sexual abuse can make you gay. My word. My word. So you're subjected to domestic violence or sexual abuse, and that can make you gay. I've got to say to everybody here, to anybody listening, this just needs to be stopped. And I'll keep saying that. Inhumane, cruel practices that is detrimental to people's mental health.
So, reactions, please, panel. And in a sentence or two, what would you say to Doug Beattie, the mover of the motion in Stormont?
Well, the problem here is the same thing that we faced all day yesterday and in Canada. He's conflating two things. He's conflating the method of trying to change someone's orientation and the outcome that people may want. And as long as they do that, we can't actually have a rational discussion with them.
Anne, do you have anything to add?
Well, Jojo's more politically correct because I watched that and I thought, wow, he is a great pontificator. He is very good, but pretty much everything he says is erroneous and not supported by literature. It's not supported by studies, and it is partly, it is this kind of other political activism that's pushing much of this. So it's pretty sad. It's pretty scary.
How about you, Laura? Any comment?
Yes, well, he has a battle with a whole lot of abundant, rigorous international research showing that same-sex attraction is not biologically determined, and that it often changes for many people, and that most people who have same-sex attraction already have some opposite-sex attraction, and their sexual attraction often changes, and mostly toward or to heterosexual through life experience. Therapy is life experience. And it can be caused, potentially, there is evidence it can be caused by childhood sexual abuse, which I just talked about a little while ago. I think he lives in a bubble with people who agree with him, and he does not have empathy with people who have changed, who found, I just presented the research, people who reduce their depression and suicidality and increase their self-esteem through this therapy because they drastically reduce their same-sex behavior, and they reduce significantly reduce their same-sex attraction, and their lives are what they're living the life they want to live. And he wants to take that away from them because their experience isn't like his experience.
Well, we have a lot of work to do, but just to tell everybody who is tuning in this evening that next week you can watch a special program led by X Out Loud. There will be several young people from a transgender background and from a former LGB background who will be sharing their stories on this channel, same time, Thursday, the 6th of May. Please come and listen to them and support them as they respond exactly to what Doug Beatty was saying. So we'll look forward to that. Now, folks, I left out a clip that we really need to say. So we're going to say goodbye, and then I'm going to ask Jared if he would show that clip to play us out today, because I think it's really important. This is one of Jose's productions, and there are several like it. Check them out on his website. It's really worth looking at. Anything you want to say, Anne, in closing, followed by Jose and Laura, and then we'll sign off and watch the video. Anne.
I just want to say thank you. Thank you for doing what you're doing and getting this word out, and because people need to hear the truth, and that's a hard thing to get through to people these days. So thank you very much.
You're welcome, and good to have you. Jose.
Well, I mean, I think I would look at that video, and maybe it's my American-Canadian streak here, but you should sue that guy for what he said about your organization, because clearly you don't torture people, but he just conflated it that way. Yes. I think ultimately just is this. We can't debate those people unless we also show the goodness as well as the factualness of our position. Mm-hmm. And so part of the strategy in Northern Ireland that you need to start thinking about is, how do we present this first to our allies in the churches, and then how do we get that to the public? That's what we've been doing here in Canada.
I like that. Really important. Laura, last word.
Well, I'd like to say that there are many professional organizations around the world that support change-allowing therapy. The IFTCC is one of those international organizations. There are others. There are probably over 70 of them. And it's based on research and people's stories, people's lives. We're going to see now an example of a changed life. I think this will say a lot.
Thank you so much. So, producer, if you would show the last clip, and we'll say goodbye and good night. God bless you. Thank you all for being here this evening. Come back next week, Thursday, the 6th of May. I think there's going to be something really special that takes place then. Thank you and good night.
Therapy ban in Canada. Can you tell me what is actually banned?
Hi there. The government wants to assure us that their ban on conversion therapy would only ban harmful practices. And of course, there would be no controversy if that's all that it bans. Listen to the Justice Minister.
I note that Bill C-6's proposed definition of conversion therapy is restricted to practices, treatments, or services that are aimed at a particular purpose, that is, changing a fundamental part of who a person is. Accordingly, practices, treatments, or services designed to achieve other purposes would not be captured by the definition, such as treatments to assist a person in realizing their choice to align their physical appearance and characteristics with their gender identity, and therapies that assist a person in exploring their identity, known as gender-affirming treatments.
That sounds reasonable, but the government's ban doesn't include the phrase changing a fundamental part of who a person is. Remember, the ban defines conversion therapy to include any practice, treatment, or service to reduce non-heterosexual behavior. This phrase isn't used by any professional body in North America. By banning the goal of reducing sexual behavior, the ban may capture all kinds of ways people can help each other. Different groups label their religious ceremonies as practices, for example. Many churches, mosques, temples, and synagogues hold services. They even have prayer services. The city of Edmonton passed their own conversion therapy ban using almost the same definition of conversion therapy as the federal government. We asked them if their definition included praying for someone, even someone who asks to reduce their non-heterosexual behavior. The council said no. But one of the witnesses insisted that prayer would also be a practice banned by the bylaw. This person is Chris Wells, the author of these laws in Alberta and in Ottawa.
Plan to send bylaw officers at every church, synagogue, mosque, or temple to make sure they're not praying the gay away, as Dr. Chris Wells said.
But how can they ban prayer?
The law seems written with an end goal in mind. You can't discourage non-heterosexual orientation or behavior, even if the patient wants it reduced. Professional counselors tell us their goal is to never decide the outcome of a counseling session. They believe their patient should tell them what they want for their lives, and it is their job to help their patient get to that goal. Like a GPS, the patient programs the destination, and the GPS gives the direction to that destination. If counselors don't want to dictate outcomes for the patient, why does the government think it can dictate the outcome?
Yeah, that's a good question. But really, can anyone really consent to torture? Too many people are coerced into counseling sessions they don't want, right?
Unfortunately, the words torture or coercion aren't even included in the law. People like Chris Wells argue that no one has ever wanted this kind of counseling of their own free will. In a CBC clip, Chris Wells compares people who want this counseling to drunk drivers who should not be allowed to get counseling because they are so inebriated they can't think straight.
Even though some adults of their own free will seek out some version of conversion therapy, Wells says the practice is simply dangerous, regardless of age.
There are all kinds of practices that we restrict adults from engaging in, even if they should desire, such as driving a car without a seatbelt, driving their motor vehicle while intoxicated or impaired, because we know that this just doesn't harm themselves, but it's detrimental to the values and beliefs of our society.
But Colette spoke at the Justice Committee about how she needed to have her non-heterosexual behavior and attractions reduced, and the counseling and support she received saved her life.
My name is Colette, and I'm from Lethbridge, Alberta. I am a mom and a wife, and I have 3 of the world's most beautiful children. I'm here today to tell you about how counseling helped me survive terrible trauma. Despite the government's assurances, my life-saving counseling would become illegal if Bill C-6 is passed. And that's why I think it's so important for you to hear my story. When I was a child, I was abused. Because of it, I struggled for many years with sexual behavior and attractions that I did not want. I compulsively masturbated, I had intrusive gay fantasies and rape fantasies. And my developing attractions and behaviors got worse after I was gang raped as a teenager. 3 men that I knew raped me and damaged my sexual well-being. And this horrible moment led to even worse sexual problems, like the use of pornography that involved rape and rape fantasies, both heterosexual and non-heterosexual behaviors that severely distressed me. This trauma negatively impacted my sexual intimacy with my husband. I had difficulty with even casual relationships because they triggered an urge to seek out sexually addictive behaviors, both gay and straight. I saw the world through a lens of sexual pain and confusion, and life became unbearable. Thankfully, I found support in 2 places, from a University of Lethbridge counselor whose service I paid for, and a faith-based sex addiction group. Both helped reduce my non-heterosexual behavior, and this support saved my marriage, my sanity, and my life. The government has argued that Bill C-6 will not ban the counseling I received because it exempts the exploration of a person's identity or its development. But I need to make this clear. I was not interested in exploring my non-heterosexual attractions and behaviors or its development, as I knew where they came from. I needed to reduce these behaviors. Both my secular counselor and my faith-based support group are a practice, treatment, or service that help me repress or reduce non-heterosexual attraction or sexual behavior. And under Bill C-6, this life-saving treatment that I freely chose would be criminal.
She doesn't sound inebriated at all.
Exactly. Yet the Justice Minister admits that the ban prevents patients like Colette from getting the paid counseling that saved her life.
We also recognize that criminalizing profiting from conversion therapy means that consulting adults will be prevented from accessing conversion therapy unless it is available free of charge. This is because deterring this harmful practice requires placing limits on its availability, and these limits assist in avoiding psychological harm to the individuals who may be subjected to it, as well as harm to the dignity and equality rights of a marginalized group.
Yeah, harmful practices should be banned, but I don't think the counseling that Colette received was harmful at all.
And Colette doesn't think it was harmful either. In fact, it saved her life. But the ban denies her and LGBTQ Canadians counseling that everyone else is allowed to get. Wouldn't that be discriminating against someone just because of their sexual orientation or gender identity?